My name is Christine Forrest, and I decided to do my final on case study 18. I've decided this case study was about anorexia nervosa, so I will be discussing everything based off of the diagnosis of anorexia. Julia was a healthy and studious young girl. She was very into school and eventually into sports. She became part of the track and cross country teams in school. When she reached college, her and her friends were involved in the freshman 15. This is the idea that your freshman year you gain 15 pounds. Her coach noticed a change in how fast she was running and told her in order to perform better, she should go on a diet and lose some weight. She decided her coach was right and she started a diet. She then dropped down to the original 130 pounds she was, and she noticed her performance became better. She decided since she lost the weight so fast, she would set a goal of 115 pounds, which she reached and surpassed when she eventually only weighed 103 pounds. She was working out to the extremes and was barely eating. She then realized when finals came around she didn't have as much time to work out, so she decided she would cut back on eating even more so that she didn't gain any weight back. She eventually stopped seeing her friends as much, and she didn't want to see her family at all because she didn't want to be judged. The diagnosis of anorexia would fit for Julia's condition. The DSM-5 criteria for a person with anorexia nervosa is that an individual purposely takes in too little nourishment, resulting in body weight that is very low and below that of other people of similar age and gender. Individual is very fearful of gaining weight or repeatedly seeks to prevent weight gain despite low body weight. An individual has a distorted body perception, places inappropriate emphasis on weight or shape in judgments of herself or himself, or fails to appreciate the serious implications of her or his low weight. Comorbid diagnosis, depression disorder that includes the presence of sadness, feelings of emptiness, or irritable mood. This occurs with the person also having cognitive changes that affect the person's capacity to function. Anxiety and panic disorders relate to a person who has recurring or unexpected panic attacks that may include trembling or shaking, shortness of breath, and feeling of impending doom. Bipolar disorder is periods of highs and lows. PTSD is a trauma and stress-related disorder. OCD is when a person has repeated thoughts or feelings that they eventually carry out in order to relieve the stress. Other possible diagnoses could have included bulimia nervosa, which is very similar to anorexia nervosa, except Julia was not going through binge eating episodes. She was trying to stop eating. Another diagnosis could have been obsessive compulsive disorder or atypical eating disorder, which in a sense is a combination of many eating disorders in the patterns they form. PTSD was another possible diagnosis, except there was no sign of trauma and she was not having flashbacks. Enhanced cognitive behavioral therapy is known to have the most success when it comes to eating disorders. The main goal of cognitive behavioral therapy is to help normalize eating patterns and to support behaviors that result in weight gain. I would have her begin to write everything down that she eats on a day-to-day basis. Step 1, I would explain to Julia what anorexia nervosa is and explain why I came up with this diagnosis. I would then talk to her about how we would move forward and how much change she feels she can handle to start with. I would try to motivate her to work towards a goal that will lead to a full recovery. Step 2 would to be set up a meal plan that will include upping her caloric intake to help her gain weight to reach a healthy weight. Next, I would talk to her about any concerns she may have regarding the weight gain. I would make sure I would talk to her about how eating more is going to affect her physically and psychologically. I would also ask her to continue the journal of everything she eats day to day. Step 3 consists of talking to Julia about what she thinks she can do next in order to keep on the path of gaining weight in a healthy way. I would then discuss any setbacks that may have taken place or any concerns of relapse she may feel. I would then identify a way to correct any of the issues that have taken place. Cognitive behavioral therapy for anorexia nervosa typically takes between 10 and 20 sessions. Depending on the age range of the person, they may feel more comfortable doing therapy individually, in a group, or even with family. This form of treatment is goal-oriented in the hopes of getting rid of any negative thought patterns and changing them to healthy thoughts. Cognitive behavioral therapy is usually combined with other treatments in order to get the most success possible. Nutritional counseling is an essential part of any treatment related to eating disorders. Nutritional counseling helps to form an eating plan to maintain a healthy weight. People may benefit from a medical supervised diet in order to get back to a healthy weight. Nutritional counseling is a very important part of the recovery process, and it helps in all long-term success. Psychotherapy helps a person understand the reasons behind the eating disorder. This will also assist on the road to recovery. Psychotherapy also helps to improve relationships and helps the person cope with any stress they may have. This is also a way to help treat any coexisting disorders that a person suffers from. Up to 50% of people who suffer from eating disorders also suffer from other disorders such as depression and anxiety. Medically assisted treatment helps the most with patients who are extremely underweight and therefore medical attention may be necessary. Symptoms of an eating disorder can become life-threatening quickly. The most important aspect of this treatment is to get the person to a healthy weight. Chronic anorexia can result in heart damage, anemia, low blood pressure, or even organ failure. Continued treatment by a medical doctor is essential. Medications can be used in order to help a person with eating disorders. Medications also can help with coexisting conditions. Common medications include antidepressants or anti-anxiety agents. Family-based therapy is the most effective in children and teens. This therapy helps to involve the family in eating patterns and habits. This therapy also educates the family on eating disorders and teaches them how to handle a child with an eating disorder. Inpatient treatment centers offer a structured environment, helping the client to be monitored and also help them learn healthy habits. This removes the client from factors that may be causing the eating disorder. It also helps the client cope with everything going on. Removing the stress from everyday life helps the patient to focus on a full recovery.